Today, I'm laying out additional steps we should be taking to deliver these life-saving vaccines to more Americans. First, we're going to provide more incentives to encourage unvaccinated Americans to get vaccinated. That starts with paid leave to get the shot. We're still hearing that people are unable to get time off from their employer to get vaccinated. Well, this is unacceptable. For some time now, I've said you should be able to get the shot and still get paid. Thanks to the American Rescue Plan, the federal government is fully reimbursing any small or medium-sized business that provides workers with paid time off to get vaccinated. Employers, this costs you nothing. If you haven't given employees paid time off, do it now, please. Today, I'm announcing that we're taking this a step further. The federal government will now reimburse those employers who give their staffs time off, not only to get themselves vaccinated, but also to get their family members vaccinated. That means employers can get reimbursed if they give parents time off with paid leave to take their kids or their own parents to get vaccinated. So I'm calling on all employees across the country to give paid time off to get the shot or to help a family member do so. I promise you, it will cost you, the employer, nothing. You'll be reimbursed. Secondly, I'm announcing that we'll continue to work with states to encourage unvaccinated people to get vaccinated. In February, the grocery store chain Kroger's offered $100 to their associates if they would get vaccinated, and it worked. Vaccination rates moved up from 50% to 75% among their employees. States like New Mexico, Ohio, and Colorado are offering similar incentive programs that have helped increase vaccination rates. So today, I'm calling on all states and local governments to use funding they have received, including from the American Rescue Plan, to give $100 to anyone who gets fully vaccinated. I know the paying people to get vaccinated might sound unfair to folks who've gotten vaccinated already. But here's the deal. If incentives help us beat this virus, I believe we should use them. We all benefit if we can get more people vaccinated. But in addition to providing incentives to encourage vaccination, it's time to impose requirements on key groups to make sure they're vaccinated. Excuse me. Just this week, we took an important step to protect our veterans. Like many civilian hospital systems are doing, the Department of Veterans Affairs will now require COVID-19 vaccines for doctors and nurses and other healthcare workers who provide medical care for our veterans. We must do everything possible to protect our veterans from getting COVID when they come to get medical care they so richly earned serving their country. We owe them. Next, since many vaccinations are required for active duty military today, I'm asking the Defense Department to look into how and when they will add COVID-19 to the list of vaccinations the armed forces must get. Our men and women in uniform who protect this country from grave threats should be protected as much as possible from getting COVID-19. I think this is particularly important because our troops serve in places throughout the world, many where vaccination rates are low and disease is prevalent. Next, every federal government employee will be asked to attest to their vaccination status. Anyone who does not attest or is not vaccinated will be required to mask no matter where they work, test 1 or 2 times a week to see if they've acquired COVID, socially distance, and generally will not be allowed to travel for work. Likewise, today, I'm directing my administration to take steps to apply similar standards to all federal contractors. If you want to do business with the federal government, get your workers vaccinated. Look at the Chamber of Commerce, representing tens of thousands of American businesses, and that